Another thing is also if the patient has had the wart for more than 6 months. So that means the body is so used to it already, it's harder to get rid of.
The body's like, you are one of us now.
Yes, like we are friends now.
Welcome home.
And then let's make more babies and grow more and then spread.
Welcome back to the Crackdown. Today I'm here with Shuang.
Hi.
Shuang's a foot doctor.
Podiatrist.
She works at the FootDoctor Podiatry. She's a podiatrist. Can you tell us a little bit
About podiatry or about foot doctor?
I have so many questions. Maybe about podiatry first.
Okay.
Yes. Can you tell me?
So podiatry is quite new in Malaysia. But in general, podiatrists, we're not fully medical doctors. Okay, we are like specialists like you. Okay, so we specialize straight away in uni. But in Australia, where we graduate as a doctor. So that's why there's just that little confusion over there. But so my patients, they call me doctor, some they call me Miss Shuang. Doesn't matter to me. So yes. So
And that's
so podiatry. The difference between a podiatrist and an orthopedic. Okay, that's usually where people get confused. Is that we don't do surgery. Okay, so we do really minor surgeries like inguinal related, so we give them anesthetic and then we numb the toe. But anything more than that is covered by the doctors, like orthopedic or dermatologists for like worn or corn removals, bone surgeries, any of those. So that's the difference. So we do mainly conservative treatment, orthotic prescription, diabetic patients where they have ulcers, even diabetic foot prevention. So we give education to how to prevent, and then all sorts of skin issues, corns, warts, nails, fingernail, ingronail, and then any sort of foot pain. So like patient comes to us, this place hurts, and then we'll diagnose and see what's going on.
So it covers actually quite a wide range of condition. Because when we think of foot, it's like leg pain, I go see doctor. But when you really break it down like that, there's heel, there's diabetic foot, there is nail, there is all these different issues as well. So that would explain the birth of your clinic, the FootDoctor Podiatry.
Yes, so it's straightforward enough.
It is. And how many years have you been running this place for?
I think this year we are turning 8 or 9. 8, I think 8 years. This year we're turning 8. Yes, so been practicing in Malaysia for more than 10 years, but this clinic itself is about 8 years.
It's 8 years old.
Yes.
So been running it solo all this time.
Solo, yes, unfortunately, because there are no other podiatrists available. I mean, we get really good offers overseas. So that's why, every time you get to compare, you sort of like don't want to go through the startup and everything and go practice somewhere overseas.
Exactly.
So yes, so unfortunately I don't really get a lot of option to hire and get help as well.
Yes, and you graduated from Perth.
Yes,
right?
Western Australia.
Western Australia. So you were practicing there for a while before coming back, or after graduating?
No, I actually came back straight away.
Yeah,
I came back straight away
okay.
because of some family reasons. So I came back straight away. But I think it's still a good choice. I was really lucky that my lecturers gave me a heads up and said like, I think you're ready. Just go. So okay, here I am.
And you're definitely one of the first few that started a practice here solely doing podiatry, because I think some places they combine with other treatments, right?
Yeah.
And to run that, you're so brave, and that is obviously such a good move. So congratulations. I'm sure you achieve a lot more, but what you've achieved so far is very, very inspiring.
Oh, thank you.
That is amazing. So we have a couple of patients that we share. Some were referred to me, some I refer them to you. And whenever somebody comes in telling me they have pain that is a little bit out of a chiropractic scope, I would just say, go and see Dr. Lin.
Yes.
This is the number, call her.
Yeah.
And the conditions that usually make me do that straight away are corn.
Okay.
Chiropractors can't treat corns, duh.
Yes. I can't believe they asked you about corns.
I mean, to be fair, sometimes we're like friends with clients, right? So they're not really like, can you do something about it? But they're like, do you know anyone?
Okay.
It's like, should I go to a manicurist? I'm like, no.
No. Fair enough.
Go to a professional. But how would you say it's different compared to somebody? Because corn can happen over and over if the root cause is not fixed, right? And a lot of people I know, they don't know about podiatry until I tell them.
Yes.
So they actually just go to a nail place to like get it fixed, like shave, and then a couple 5-6 weeks later they go again.
Correct. Yes.
how would you...
So unfortunately with cons, they are never really reversible. So if they come and see me, I would tell them the same thing, okay? And my patients, depending on the age, alright, so like a younger person, their cons when they recur is not as frequent because we still have our collagen and flexibility in the skin.
Collagen, I miss
so,
it.
Yes,
I miss collagen.
We still have it, we still have it.
Do we?
Yes,
it's like this much.
So the flexibility and the soft tissue still allows the skin to regenerate and resist the friction from the walking quite well. So therefore, our cons don't regrow that fast.
Okay.
But when for an elderly, they are you can see that their skin are much drier, and skin is much stiffer as well. So that's why the con grows much faster.
So I never really
so
knew.
cons are usually due to pressure, basically friction.
Yes.
Okay, so the way you walk, you're loading too much on the spot, so the skin cannot tahan the pressure, and therefore they produce more skin to protect itself, to protect whatever that's under. But what we don't know is that the overgrowth of it causes pressure. It's like imagine you're stepping on a stone all the time,
over and over,
then it presses onto your joint or your tendon, your muscle, and therefore creating pain.
Okay.
So that's why usually people, when it's still small, there's like no pain, also just ignore.
Yes.
You know? So then that's when it becomes deeper and deeper, bigger, and becomes painful.
Because it's actually quite useful from a chiropractic standpoint when somebody comes in with corn.
Yes.
I kind of know where they bear weight.
Yes.
So it gives me a lot of information about
Correct,
what happens to the kinetic chain, to the knee, to the hip. So we are kind of looking at different things, but at the same time, it's so useful.
Yes.
So I'm like, okay, go get it fixed. And usually, how quickly it returns depend on how quickly their turnover is.
Their age, how willing are they to wear like better shoes, take away the pressure. So we will discuss about their lifestyle as well, what is causing it. Some people, maybe they do dancing. So like for example, ballet dancing, Latin dancing, that kind of thing, they will have to load more on that spot. You know? So like maybe we just give them some sort of padding to reduce the pressure. So it's a lot of lifestyle understanding of the patient as well. So, so on our like registration form, we always ask about occupation. So some people, they feel very offended, you know, like why you want to know so much
based
about
on
my
what I
life?
do, how much money I make.
At the end of the day, I will still ask that question. So what do you do? Like even if it's a homemaker,
understand.
It gives us give me a lot of insight about her lifestyle as well. You know, first question I will ask about homemaker is, so you cook a lot, I assume. So cooking, you know, hard floor cooking at home, mostly at home, they are not wearing shoes. Even if they do, they're wearing like slippers. And slippers, sometimes they don't give enough support. So straight away, you know, like everything, it sort of lines up like what I want to tell the patient as well.
And when I was like, you are home a lot, you don't wear shoes. At home you don't wear shoe one, man? And I was like,
and then the next question, like, you want me to wear closed shoes at home?
Not you so hot, exactly.
So cons is very lifestyle related. Shoes that you wear and what you do every day.
And that's why it's so common too.
Correct, So there's a small group where this condition, we call it hyperkeratosis. Okay, so hyperkeratosis is a medical condition where the hard skin grows too much, too fast. And that's something we need to work with dermatologists. So I have had like this small percentage of my patients where they come in every month and they have like at least 10 cons in their feet, all around their feet. 10 cons everywhere. So this is not due to just pressure on its own. And this kind of patients, because we are like friends eventually because they come see me so often, what I notice is it's actually even stress related. Like sometimes when they work more, they are into some certain phase of their life, it just grows so fast. So but hyperkeratosis, we basically need to work with dermatologists. They have like some steroid cream involved usually, and then really good urea cream moisturizers to work together. So it's not just the normal like pressure offloading that we're looking at. Yeah, but that's the smaller percentage.
Yes. And who would have thought coming to see a foot doctor would kind of reflect on stress levels, and the doctor's asking you, are you stressed in your life? Like, what is that got to do with my feet?
Well, I wouldn't know it on the first consultation, the initial one. It's more of how frequently we see them eventually. Like sometimes, because they see me for years, right? So sometimes they see me much more like in a shorter period of time, sometimes longer. Then that's what I notice. So because they know, they will just call, make an appointment. By the time it starts hurting a little bit.
Yes, and like fix it for me. Like, I don't want to deal with it. Just do
and
everything.
they usually will come the day before their big day. So a lot of our patients, when they come see me first time for corn, they'll be like, it's gonna hurt, right? It's gonna hurt. It's so painful. Blah blah blah. Then I say, don't worry. Eventually, we're gonna be friends. You're gonna come the day before you travel because you want a pain-free leg. You want a pain-free foot, and then so you can walk as much as possible. So that's. Corns are generally pain-free removal, unless it's super deep. Otherwise, it's okay, and it's not as scary.
And I'm sure if it's deep, you don't take it all out at one go, right?
Yeah.
You
so it
kind of
depends
preempt
on
them.
how. Yeah, it depends on how much the patient can take it. And everything.
I actually have a client who has been so afraid to see you, even though I told her she's the most gentle, like get as much information as you want online and make a decision. She has watched all the videos on YouTube. It's like, I think I need 3 months to be mentally prepared. So I've given her your number, I think 2 months ago. If she hasn't called yet, that means she's still not ready. So I hope
one
she
more month to
sees
go. We
this
have set alarm on
video
that.
and like, this is her. Like, it's fine, you know, your feet's gonna be fine. But yes, coming into weight bearing and corn. Apart from those moments where you notice that there are problems with their mechanics, were there also moments in your practice where you realize that feet and spinal health are possibly related? Were there cases where you've seen them and you feel like, oh, this might be more than just a simple problem that they have imagined?
So anytime when they come to see me for any sort of foot pain, apart from the corn, yes, I would check their walking, but like warts, nail cases, I don't check their walking. So any other foot pain, like heel pain, forefoot pain, anywhere, we always check their walking. So from the walking, I will see if it's purely foot or like the spine related. So it's quite straightforward that I'll be able to see. But sometimes some patients, towards the end, suddenly they ask me this question. So I also have lower back pain. Do you think it's related? So I get this question a lot. Like
they themselves already
they will
have
ask
a hunch.
me like or some even come the moment they sit down say, I have lower back pain. I think it's related to the feet. But this group of people, I would say, is actually I will always answer them. Yes, it's related, but it's actually not as common as we think. So a lot of people like to blame that they have back pain, therefore it's because of their flat feet. So that's not true. Flat feet is really just a type of feet. It doesn't mean that you have flat feet, therefore you
deserve to have back pain.
So it's not as straightforward. A lot of our lifestyle and everything, we have very weak back muscles. So I always tell
patient number one. You got called out.
Well, I wasn't looking there. So
That's okay. It's okay.
I would always tell them to work on your back muscles first, like strengthen your back muscles, do whatever exercise that you think is helping on your muscles. Then if you still think whatever I do here for your feet is not helping, then it's worth looking at chiropractors to see if anything is wrong with your spine. Because it's not always the case.
True.
So that's more of what I see. It's like not to say every time I see a heel pain case, it's always back related. In fact, they like to blame it that way. But I would say that it's because your back is just so weak. So you don't even have enough strength to lift your thigh up. So your knee flexion is so weak. And so imagine all your weight is just stomping on your foot all the time. So Therefore, you have all these heel pain problems. So
Exactly.
don't blame your back. You blame your lack of exercise.
Exactly.
Yeah.
I cannot agree with you. I don't know how many times I've said exactly. Because that is like what I have in my
what
mind.
you practice, right? And
when
what I
somebody
say
comes
every
in,
day.
it's like the reverse. So they'll be like, I come in with low back pain. Oh, I also have flat feet.
Yeah.
I think because of my flat feet, like my dad also got flat feet, my mom
Yeah.
also got flat feet, that's why I got flat feet.
Yeah.
And then they also got back pain, that's why I got back pain. I'm like, okay, genetic is like, yes, we cannot ignore it.
Yeah.
But have you
Lifestyle.
been slouching on your chair 10 hours a day? Have you been sleeping face down? Have you also not been exercising? Like, all these things come into play, right?
Yeah.
Sometimes it's good that there is a professional kind of reminding them, like, yes, like there's maybe a 1%,
Yeah.
but there's also this 99% where you can control and you can change. So yeah, don't blame it on genetics, guys. It's not always the feet. It's not always the flesh.
Always reflect on yourself first.
Yes, look inwards. Don't blame others. Don't blame your parents.
Is weight a factor?
Oh, good question.
Yeah. I will say no. I will say no. Like I said, reflect on yourself. You ask yourself whether you've done enough exercises first, and then. But weight, I would say, like, if you're a very skinny person and you are very like versus another person next to you is very heavy, obese, that both of you can get heel pain and both of you can get lower back pain.
Agree.
Yeah. So, but unless you suddenly put on too much weight in a short period of time,
Yes.
then it's quite possible.
like pregnancy, right?
Yes,
Some
yes,
people get a little bit more of a pronated foot
Yeah.
during pregnancy. Agree. And there are people who are overweight but not have flat feet. And there are very skinny people
Yes.
who have flat feet.
Yeah.
So
well,
then
if you
by
look at
that,
the other end,
Yeah.
a high arch person will also have all the same problem as a flat feet person. has.
agree.
So,
Yes.
so you can't just blame on your flat feet.
Yes.
Yeah, it's really just a type of
Yes,
feet.
yes,
Yeah.
yes. It's just whether or not it's giving you issue or if it's agreeing with your current lifestyle or not.
Yeah,
what you
yeah.
have. Agree. So I hope that answered your questions. You have.
There you go. Very good reflecting on themselves.
Yeah. Look inwards. Look in front of the mirror.
Can't tell.
Does it hurt?
No.
Okay, then don't think too much about it.
That's why at the end of the day, the shape of your foot, it's just how you're born with, like big eye, small eye. I would always the
small eye,
person
see,
with
let's
big
see,
eye.
let's see.
Not really exactly. So it's a person who has a big eye or a small eye doesn't affect unless you can't walk. Okay, that's a different story. Like you actually like bend your knees when you walk. That means you're not able to straighten your knees when you're walking. That's another level of flat feet that we're looking at past planners.
Yes.
Those talipes valgus foot where their foot can't even straighten. So that's a different kind of flat feet that we're talking about. Yes, but even on kids, we'll just cover that. So even on kids, when we see severe cases like that, when they're already walking, then we really assess their walking and not send them for surgery straight away. So like some can look really, really bad, but if they're walking fine, they're even running in school, and they come back and say, I have no pain. So then why should you, send them for like ankle reconstruction just for that? So personally, what I would think it's not worth it. But I've seen a case, I do refer to orthopedic as well whenever necessary. So I've seen a case where the child walks with their knee like bended inwards, like knock knee, very bad knock knee. So the foot is going outwards and the knee is going inwards as he walks. So as an adult, you look like this looks like a lot of stress on the knees and on the lower back.
Yes.
And this kind of case. So then, yes, it's worth considering. I will refer to a pediatric orthopedic and let's see how he or she says about it. Yeah, so
Co-manage with a few different professionals. That makes sense. We have a lot of patients coming in, and it's more of a curiosity question. They probably don't think there's something wrong as well. Let's just say a kid, 4 to 5 year old, starting to look like got flat feet. And then the parents think, I also got flat feet. My husband's also got flat feet. But maybe if we start changing it now, would it benefit this kid's future? Like, is it better to start wearing insoles when the feet is still growing? What's your take on that?
Again, I look at the current sign and symptom of the child.
Like
So
if
we will-
symptomless, that means no
Yes.
pain, I'm running.
Yep.
Sometimes, kids run and fall. But
So
that's about it.
asymptomatic basically. Okay, so even to be fair, even in the podiatry world, this is a big and huge topic. Like asymptomatic flat feet, treat or not.
Yeah.
So because once the problem arises, then yes, it's always related to the flat feet. Okay, but then again, I mentioned just now, high arch or flat feet, you will have the same type of problem.
You cannot
So you cannot,
guarantee.
you cannot guarantee. So that's why, unfortunately, I also cannot give you a very certain answer to this because even the study cannot tell us a certain
Yes.
direction yet.
Well, you have a son, 3-year-old this year.
Yeah,
3?
turning 3.
Congrats!
Time flies, thank
oh
you.
my gosh. But let's just say he has like the flattest feet ever. Like the
Yeah.
flattest flat.
Yeah.
What would you do?
Yeah,
But
so
no
the
symptoms.
So the first thing we look at is the shoe, right? So you need to start managing it with the shoe,
Okay.
to prevent it from worsening.
Okay.
And barefoot walking as well. So barefoot walking not at home, but outside, muddy area, grass area, anywhere uneven but safe. Okay, so like especially those indoor playgrounds, but those are usually carpeted lah. But for me, I do send my, not to say I send my child, I bring my him to playground and I take his shoes off whenever I feel it's safe.
Whenever there's like surfaces where he can get different sensory
Anywhere
stimulation,
anywhere that you think it's a different type of texture and safe, then it's a good place to develop the foot muscles. The foot muscles, yes, feet muscles. Right. So, and then next thing is the shoe wear. So don't get shoes that is too, like imagine like a piece of cloth under, just a piece of cloth
Yeah.
and no support basically.
Yes.
So that's not so advisable. Basically a runner is like one of the best. Okay, so like a runner that has a proper heel cup that when you squeeze it, you feel a little bit of resistance.
so quite hard when you try to squeeze it.
Yeah,
this way.
just a little bit of resistance. You don't want it to be hard. Like for a child that age, toddler, we don't want it to be hard. So something like semi-resistant. Okay, and then when you fold the shoe, it does bend into half, but it's not like
like a ballet shoe, so
correct.
easily
So
bend.
where you can even squeeze it around like that.
Like with one hand.
Yes, yeah. So you can squeeze into half one hand, like the rubbery silicone ones. That's okay. I'm talking about like imagine like a ballerina shoe where it's cloth and you can like shake it around this way. So that's really like pretty much a cloth. Okay, then usually that's not so advisable. So we need the cushion from the bottom of the shoe as well.
Got it. And this advice is just for like kids that are developing or
And
it's also-
asymptomatic.
and asymptomatic.
Yes, so
And with adults, it's a little different.
Yes, adults a little bit different because they're again lifestyle. A lot of things has changed. A lot more parts of the body are involved, so we will advise differently. So let's say an adult presenting with skewed towards a flat feet foot, pronated foot, hyperpronated foot, and then they're presenting with symptoms and they want to wear better shoe, then yes, you would need a sturdy heel cup.
Still the same advice, but probably a bit sturdier than
Yes, like you want it hard this time, okay? So because the adult one, when it's stiff and firm, when we land on our heel, okay, it stops it, it controls it in a better position already before you put the whole foot down. So that's why you want it to be stiff, okay? And then when you put your whole foot down, that's when midfoot, the stance phase happens. Then you want the outsole to be thick as well. So the outsole, it acts as a shock absorption.
Yes.
The shoe acts as a shock absorption.
Got it.
And then, so you don't want the shoe to be bendable into half this time.
Yes.
As an adult, like so, when we say adult kids, when do we start deviating?
Yes.
It's more of like as they increase their activity in maybe like end of primary school, like 10, 11.
Okay.
Or someone, if they're more active, then after they hit puberty, about 15, 16.
Okay.
Then if they have this kind of problem, then they should be wearing something that's like more supportive. So, and then lastly, we don't want the shoe to bend into half. We want it to bend somewhere near the toe bends, so like about 1/3 towards the forefoot side of it, but not into half. Okay? So
Makes
yeah,
sense.
so when it comes to heel pain as well, this is actually the basic the patient should try first.
Yes.
Before we consider whether the patient needs an orthotics or not.
Yes.
Yeah,
That was
so-
going to be my next question.
Yeah, so like we were talking about the flat feet part
Yes.
of orthotics. So when a child comes in, 3 questions. One is, of course, if the child has any pain. Okay. Secondly is if they fall down very easily. So frequent falls. Okay.
Yes.
And then then the next thing is what is the parent trying to achieve here?
Yes.
Yes. So
The perfect arch
yeah,
on my child.
So, unfortunately,
Especially when the parents both like that.
Yeah.
And then they want a kid to have that.
so I would blame this on all the wrong marketing that Malaysia has.
It's like
that's
fear
not controlled.
tactic. It's
Yes,
like,
yeah.
or like the auntie, right? You see
Yeah.
your kid feet like that.
Yeah, so then as a parent they feel like, I should do something.
yeah.
Yes, so of course, yes, a lot of things can be controlled, but we cannot reverse. So especially the flat feet, I will always first tell the patient, tell the parent before we start with anything. You need to understand that I cannot reverse this. I'm here to manage the pain, manage the problem, but it's impossible I can reverse this. Anyone who tells you that they can reverse this, okay, two possibility. One is that your child is going to outgrow it anyway. So in some cases they outgrow it with the proper shoe and everything. Those that's not so mild, not so severe lah.
Yeah.
They can outgrow it. They just look like not so low arch, not so
Improve
rotated.
little bit lah.
Yes, yeah. And second thing is that it's just a fake hope. It's a false hope basically. Yeah, that
Or it's like
you are-
imagining it as like, got better a little bit.
yes. Because flat
dear.
feet, there's flexible flat feet and rigid flat feet. So rigid flat feet, definitely a no.
Rigid, that means like really...
Rigid flat feet means most of the time when the moment they sit up, you know already. So that even when they're sitting up, the arch is flat.
Okay.
Like a papan.
Yeah.
Okay?
Yeah.
It's just flat.
Like it's kissing the ground.
Yeah. So this kind of patient actually is easier. So I just tell them, when you're sitting up, there's already no arch. It's impossible that
No
when you stand up,
hope already.
the arch just comes up like that. It's impossible.
What if they force the...
Yeah, so actually for flexible flat feet, that's the kind of exercise we want them to do.
So that's not the rigid
train
type.
out. Yeah,
That's
so
the
rigid type is
flexible
also
type.
possible, but flexible type, we will we give them exercises, give them proper shoe wear, and that's the group that we can consider orthotics if they want to lah. So again, because it's asymptomatic, I discuss with the parents, and some they are like, I just want to let my child start wearing, and ASAP, if there's a chance to treat it, I want it. Okay, so fair enough. Expectation is there, then
I don't
I'm happy
care
to do it
whether
for you.
or not it
Yes.
works, but I'm just gonna try it
Yeah.
anyway. And
so if it's symptomatic, then more likely that I will ask the patient to start earlier. So for a child, let's say asymptomatic, I generally would tell them to start at 7 years old. Actually, not as young as people would expect it to be.
Okay.
So 9 years old is when our bones fully grow, our foot bones.
Okay.
So 7 years old is a safe age to start. Anything lower than that, some studies says that it stops the bone from growing well. So if it's not necessary, no.
You try
But-
not to encourage
Correct,
your
yeah.
clients
But
to do that.
in towing case is different. In towing case, we need to treat as early as possible.
Yes.
But flat feet, no. Flat feet is a different thing. So in towing case, then we will start them, like 4 or 5 years old, we'll start them.
Yeah.
But 2-3 years old is, I usually don't start them with any sort of orthotics. It's really unnecessary. If you look at X-ray of a 2-3-year-old, their bones are so far apart.
Yes.
You can't even if you wear orthotics for them, you can't really just
The bones
push
are
the
still
bones
like
away
kind of
like that.
floating around.
Yeah. So it's
on top
quite,
of the orthotic.
quite sad to start them so early, and you force them to certain shoes that that it's even easier to just go barefoot. So don't be worried about the cleanliness, the dirt. You can always wash mud or anything away, but give them more free time and barefoot chance on uneven surfaces.
Got it. That is really, really eye-opening and interesting, especially coming from a parent. I feel like I'm getting
Yes.
mum advice plus podiatry advice
What
at
I
the
would
same
do as a
time.
mom, yeah.
Yes, because we need to know what's realistic and what's not. When is the fine line where you worry, but not every worry has to be acted on,
Correct. Yeah.
which I think is important because in our center, we see kids as well. We see mums as well. And sometimes I think it's normal for mums to be kind of like, I'll just ask just to be sure, and they ask. But we have to kind of think about what we're advising to.
Yes,
we don't want them to go like,
you can't just say like, nah, it's fine.
you know, like what if it's not fine?
Yes,
you know, what
yes.
if they do hurt themselves and they'll be like, oh my god, that one day Shuang told me nothing to be worried about. What is this? You know. So it's like we give them professional advice, but at the same time, we give them all the information they need for them to decide themselves.
Yes,
I think
I give them the pro and cons, you know. So it's up to them to decide.
Yes.
But baseline is the shoe wear. So when you put yourself and your child in a good shoe on its own, then you are already laying down a good foundation there already.
Yes.
To prevent foot pain. And sometimes, of course, you still lack of exercise.
Yeah.
Not everyone like exercise. When you exercise too much, you get more other issues as well. Under exercise, you have other issues.
Yes.
So we can't. It's not possible to get perfect feet or like perfect spine all the time.
It's true.
But it's how to like what you can do.
Realistically, and not waste
Try
too
your
much
best
time
and
like
also,
perfecting something. I think a very good summary about all that we talked about is observing symptoms, whether it's your loved ones or your kid, if the symptoms really bothering them. So if in towing, like you mentioned, they must be having some form of discomfort somewhere, somehow. Maybe they're not verbalizing to you. Then it's of course normal to be worried and to seek help. But if it's just appearance of a flat feet and the kid clearly looks fine, he's not too bothered, and their feet is growing so quickly around that age too. So to go to the extreme of making orthotics, I feel like it's something that needs a little bit more consideration. So I think it's good to speak to someone honest and ethical, like Shuang.
So we will have to assess the patient. So every case is really case specific. We have to assess, and then I will judge like whether this patient needs it or not. But symptom is one of the most common one. Frequent falls. The patient falls too easily. The child falls too easily. The moment the child starts running, they'll fall. Then something's not right as well. So we need to give them extra support to run, because we want them to exercise, right? So ultimately, we are not really stopping them from even my adult patients. I'm not stopping you from doing your exercises, but you might need to twist it around a little bit. Play around what you can do, and then strengthen what you need. Then you go back to your exercise again.
Agree. That is so informative, right, guys? Oh my god, I feel like I'm attending a class in the best way possible.
I have a lecture next week. So
oh, you do?
I don't bore my students.
You're lecturing too in IMU right now?
IMU. But I'm not really like full-time lecturer. I'm a visiting lecturer. So whenever they have, for now I'm only teaching the diabetic diploma. So only when they need me in the
diabetic
foot-related
diploma.
Diabetes diploma. So I teach the foot part of it. The foot
is so niched.
So not the whole course about diabetic foot. It's the diabetic course. It's a diabetic postgrad course. Then I teach the diabetic foot part of it.
Another question that a lot of patients from Relief wanted to ask is about bunion. Because you see, I'm sure you've seen Shopee or Lazada, they sell this thing where they wear and and it goes straight. And then they come in and say, hey, Kay, this one can work or not? I'm like,
I don't know how to advise. Okay, the thing is, oh my goodness, I feel like I'm here to like make everyone sad.
Go for it.
So basically, again, bunions are not reversible. So we only manage bunion conditions. So bunion, the worst scenario is osteoarthritis. So when your bunion gets too sengit, right, and then what happens is the joint inside, they're rubbing against each other, so causing arthritis, and arthritic pain is quite painful. So all these stretching exercises, so basically the thing that we turn and all those, that's passive stretch. So you wear it and then you go to bed. But what my patient, the feedback is that they can't sleep because it's like something is stretching all the time. It's not really like you're not fully relaxed and at ease. So that's why I stopped recommending those. But actually, there's no harm. If they want to continue using, by all means.
It's just very deceiving marketing because they show
like
before after, like crack. There's even a sound like crack, and then they take out the thing. Oh, straight already. Who needs surgery? Who needs to see a doctor?
You start walking, everything comes back again.
Hello? No. But it's
good
to hear that it's a good way to stretch.
Yes. So like at the end of the day, the moment you start having bunion, your tendon and muscle over there, they tend to overstretch. You know, it's very tiring, and then when you rub it on the shoes, you feel sore. So there's no harm. If your bunion gives you pain, I would say yes, please use that. So that's more of passive stretch. I will usually teach my patients some active stretching as well. So both together, and with of course definitely a much broader shoe. So a little tip is what I usually tell my patient is that put the shoe on the floor that you want to buy, and then just hang your foot on top like that, and make sure when you look down from the top, the shoe is broader than your foot. So like you can see the outline of the shoe covering the width of your foot.
So you put your foot down and you look from the top.
Yes, so you
should
just
still be
hang
able
it
to
like
see.
that. Yeah, don't press it down, just hang it on top. So as long as you see the shoe broader, then it's not exactly squeezing onto your metatarsals. Then it you feel more at ease with your bunion around. Yes.
So that goes without saying, pointed shoe, very snug shoes are all a no-no.
Yeah, if you already have bunion and you're seeing me because of bunion and you expect me to tell you can wear high heels, it's quite impossible.
Do patients have to remove their shoes when they come to your clinic? As in,
yes.
They remove their shoes outside?
That's a very interesting question because they will come in, then I will ask them to sit on that treatment chair, and they will just sit there and look at me. And I'm like, take off your shoes. You're here for your feet, right? Like, I can't see your feet.
It's like,
your shoes
like first time meeting, like a bit shy to show you my feet. But you are the foot doctor, so like,
They are always shy. Like,
but she's the foot doctor.
Yeah, a lot of patients are very
Strange,
shy
right?
about it. Like, but really, I mean, if I can tell anyone now, it's like, please don't be shy about it. Like, we want to start looking at your questions and not asking you to please take off your shoes and socks.
How many times do you hear a day where people say like, sorry, my feet stinks, or like,
Oh
sorry,
yeah, that's
I
actually
didn't
quite,
shower, or
so
sorry,
my
I
feet
didn't.
stings maybe like at least 1 or 2 times a week.
Oh,
But
okay.
asking a patient to take off the shoe is like maybe 5 times a day. So I don't understand, like, why are you not taking off your shoes when you're here to look at me? Yeah.
Because I'm not home yet, so I cannot take off my shoes.
No, I think it's just that the lack of education thing. Like, people don't know what to expect when they see a podiatrist. Because
They want,
most of the patients, like 95% of my patients who are here to see me, is their first time seeing a podiatrist.
Yeah.
So they don't know like what to expect, they don't know what they should do, and they
Yes.
look at the treatment chair like, whoa, am I in a dental clinic?
Yeah.
So I think that's that kind of feeling that they get. So
Oh my
that's
God,
why
I
they're not taking
think
off their shoes.
I'm
So
at the other extreme of your case because I have patients who come into Chiro,
lie
never
down
been
straight
to a
away.
Chiro. No, they come in, I'm like, hey, my name is da-da-da. They take out their belt straight. So like, I don't know you want to include that or not, but it just came to me. I was like,
now that's going
like,
very
see now, I need to ask you a few questions. Like,
That's quite funny.
I was like, oh no, like, professional.
I think I would laugh. But yes, I've seen patients
But with
like
that logic, I can
Yes.
see why. Because it's like,
Yeah,
I
so
better,
they
don't know where to sit, and then like, okay, you tell me take out my shoe, and then I take my shoe.
Yeah. And then they'll be like, and then they'll be so stingy, like just only take one side of the shoe off.
Because it's only one
Please
side
take
that
both
hurts.
your feet off. Yes, both your shoes off because only when I start checking that I realize, oh, it's actually related. Every time we have a foot pain on one side, you're compensating on the other side.
Yes.
So sometimes, a lot of the times, the problem actually arises from that so-called healthy foot, and it's giving you pain on the other foot.
Yes.
So we always check on both. Or some patients will even, you're so nice, you check for everything. I said, no, it's because I need to check everything to tell you what's actually happening on this
Or
one
they
particular
thought you
problem.
charge double if you see two
Yeah, like
feet.
you charge too much. Yeah,
Come by toe.
that is very common for corns. Like, so when I do corn removals, I always remove everything, like all the calluses on the feet. Anything that I see, all the calluses, I'll remove all for one corn problem. Like, if you presented me with one corn, I will remove all, because if I don't remove the others, then the calluses will start building up, and then it becomes a corn as well. So because this side I remove already, you feel much relief already.
Yes.
Then, the pressure goes on the other side.
Compensation.
Then, yes, so I remove everything so that it's like you're starting from scratch again.
Got it. Because I think,
What about corn on fingers? corn on fingers, you need to see a dermatologist. So yeah, because our profession, we just don't cover anything above the lower limb.
Like to be
So it's more
professional,
like-
it shouldn't.
it's more of
right?
the ethic code part of it that we because we didn't learn
actually
anything.
like a skin thing more than a
Yeah,
area pain.
what are the foot things? So because in short, podiatry, we look at everything related to the foot. Pretty much everything.
Yes.
Unless we need to refer away, then we just
Unless your corn on your finger indirectly affect your foot.
Yes.
They're like, since having this corn, my toes started twitching. Then she will have to remove it for you.
You know what? That is wart. Oh, that happens with wart. And
Wart
a lot
can
of
grow
people, correct. A lot of people, they cannot differentiate between wart and corns. I didn't
couldn't.
touch about wart just now because that's another topic. Yeah. So I didn't touch about wart just now because there's another topic.
Corn is
Yeah.
like the extra.
So-
Professional.
Okay. Maybe you can tell me first. What do you think?
Okay,
the differences are?
I never had corn. I've
Yeah.
seen a lot of corn on my patients because I look at feet, right? It usually happens when there is excessive rubbing on like rough surfaces mostly, and then got extra growth that the body produced, like skin, because your body tried to cushion it for you.
And then once the water is out, it was okay already.
Yeah. So
But that was
that's
sui pao, is it?
no, that's
For water.
wow.
It looks like
Please take a video and send to me.
I think you need to go to the ER, girl.
like maybe like 6 years ago. Like, it looks like coral, coral when
Yes.
you zoom in, it's like
Yeah. So that's wart.
Oh,
That's definitely wart. Yes. So so the difference between a corn and a wart is that a wart has virus in there. Okay. So that's why when a person wart grows on plantar surfaces. So plantar, hence our palms and our feet. You can you can feel our palms like they're thicker in skin.
yes.
And then our feet is the
Like
same.
as compared to other
everywhere
parts.
else, they are soft and gentle. So this wart is, it's one of the HPV that is virus, one of the strain, okay, that is causing it. There's a lot of types of HPV viruses in the world, and it's not sexual related. Okay, this wart is not sexually related, and so it can spread from the hands to the feet if you keep touching on it. So sometimes they have it on their feet and then they just keep touching and then they're like, hey, and then they keep touching. So
They try to settle it themselves.
then it can spread to their hands.
Oh.
And vice versa. Okay, vice versa.
'cause it's
But
virus.
corns it will not spread because corns are due to pressure. It's because you keep rubbing on it. So if you have it on your hands, some people because of any certain jobs that they use it a lot. So I always tell my patient, touch wood. One day you cannot walk anymore. You are not going to see me anymore because your corn won't grow already. So you don't want that to happen also. Like you should be happy with this problem that you're still walking and therefore the corn grows and therefore you need to see me.
Wow. Hashtag gratitude.
I have a corn. I can walk.
At least I got leg. At least I can walk.
Yes, exactly.
Steven talking about no corn.
Oh my god.
That's so deep.
Amitabha. Sorry for laughing.
all going to hell.
Yeah, so if it's a wart, then we kill. So we have the treatment is to aim to kill the virus.
Okay, so if it's gone right now,
It's gone.
So
It's usually it's gone. So that's why whenever the patient comes and tell me from a corn patient, they tell me, why don't you just remove my root? I've had patient where it got a bit I felt a bit insulted, because this old lady, she's like, why don't you just treat my wart and take the root away? Like, did you do this on purpose so that I keep seeing you? Like, so that's the thing. There's the difference between a wart and a corn. So a corn is due to pressure. As you're walking, the corn will grow. But wart is due to virus. So once we kill the virus, okay, then the root is gone. Then it's gone. Yeah. So usually a relatively healthier, like young person or even a child, is more likely to be a wart than a corn. Usually, yeah. So we were talking about, remember, the strength and the stretchability of our skin. Therefore, usually
collagen.
corns, yes, it grows, starts growing at 30, 40, and then it becomes deeper, become a bigger issue as they get much older. But other than that, it's usually a wart issue. Yes.
Okay, so,
So
I mean, to
wart
be safe,
looks more a bit like coral looking. She was mentioned. She mentioned coral looking. So warts appear in like many ways, and sometimes they really look like a corn.
yeah.
So we need to assess.
Yes, please get a professional, get it professionally checked. Because if you ask me how coral look like, I don't even know how coral look like. I wouldn't even know if I
Yeah, you haven't been to like snorkeling?
I haven't zoom in to how, I mean, coral not like that.
Yes. So it look a lot of dots. So it can be sometimes white dots, sometimes black dots, sometimes grey dots. Sometimes it just looks like a patch of grey color, like black color.
So it can just happen because of a viral infection. Like
Yeah, so usually it
If you're-
spreads in a wet area. For warts, it spreads in a wet area. So for example, if a patient does a lot of swimming, so when they get out of the pool, that's when the water that is not moving, and somebody who has a wart step on it, and then you just nice on that day itself, your immune system is not able to resist that virus, then you step on it and you can get it just like that.
it doesn't have to have a cut for it to
No,
enter.
no,
It's just
it's
a
just skin.
fit to, or
Yes.
skin to skin.
Skin to skin.
That
usually
unlucky
spreads-
person stepping on the
Yeah.
pool, like oh.
So it usually spreads in wet areas, so like wet carpet, I'm super scared of wet carpet. It's like you just cannot imagine the amount of viruses in there. And then wet carpet, like
Why is the
wet
carpet
still
wet in the
area.
first place?
Exactly.
Like I said, you clean it and you haven't dried it, or
So
someone
any
peed
of that
there,
sort,
or-
any of that sort.
Why?
And then,
Why is it wet?
What else? Public toilet lah. So like if they go to the gym, they shower in the public toilet, then that's when they usually get it very easily as well.
Yes. Oh, gym. Gym
So for
must be
warts,
like
for warts we usually do cryotherapy.
Oh.
Cryotherapy, so we scrape the skin to the point where it's bleeding. It's not that as painful as you imagine it to be. Then spray liquid nitrogen, so it's cryotherapy, and then we'll give them salicylic acid home to apply, and then I'll see them every 2 weeks until it goes away. So it's not a one-off treatment.
But success rate from this cryo treatment and scraping it
Yes.
and salicylic acid is quite high, would you say?
Yeah, it's pretty high, like more than 90%.
Okay.
But a lot of cases, I still refer them away to dermatologists because if I see that the wart is too big, like anything that's bigger than maybe my thumb, maybe this is about 2 to 3 cm, anything bigger than this, it's very painful for them to endure the whole thing because it's too big, and then you're spraying ice all over. The ice is basically like a burning. So too much, then I will prefer them to go to a dermatologist for laser. So they will basically give some sort of local anesthetic, and then they just burn it. So it's faster.
Yes.
They don't
One
go
shot
through
just
that.
do everything.
But even a laser doesn't guarantee that it goes away in one session. So that's the thing with wart, because as a doctor, our naked eye cannot see.
Yes.
You cannot see the wart, you cannot see the virus. So you are only relying on the signs and symptoms and how the tissue looks like to remove the affected area.
And it's not something that like a blood test can show. There's still how much inside.
Yes, it's definitely
and
there
all
or
that.
not. Like we look at the signs and symptoms.
Yes.
So, but otherwise, another thing is also if the patient has had the wart for more than 6 months. So that means the body is so used to it already, it's harder to get rid of.
The body's like, you are one of us
Yes,
now.
like we are friends now.
Welcome home.
And then let's make more babies and grow more and it spreads. So the next thing is when it spreads. When it gets too much, again, the surface area is too big. It's very hard for them to endure all this without any anesthetic. So I refer them for dermatologists. Yep. Okay.
I also don't want wet carpet. We got the same answer. Nothing to do with spine, but I also don't like wet carpet.
The reason why I say this like wet carpet because I have encountered it twice. One of it was I went for this how do you pronounce it? York.
On the yacht.
Yeah,
Ooh,
and then they have this.
fancy.
Yeah, so I thought fancy, right? But the moment I entered the yacht, I see that wet carpet on the stairs down into the yacht. I was like, no. But there's no way. You have to step on it in order to get into there. Because otherwise you can't really hop.
But you wear shoes. Oh, you mean you're hopping off the...
Because we were staying there for 2 days.
Oh.
So then I was just, and then like my friends started asking me like, what's wrong with you? Like every time you walk past the stair, you stare at it. You just
Contemplating your
like,
life.
how to avoid that apart as much as possible. Because of this.
Because people hop on and off without shoes.
Because it's like, it's sea. So like, of course you're wet all the time.
Yes.
And then the carpet is like, so imagine I stayed on there for like less than 2 days. And it never dry out because of the weather, I guess. And because it's like sort of indoor. It's like under the yoke, right? So
How
it's like
many
sort of
like baby virus
I can't
growing?
imagine, like I just kept wiping my foot and kept drying. So
Is there a way you can like kind of go down and like hop off?
that's what I kept planning. Every time I stand there, I'm like, how can I hop? But it's just impossible. That's why it's either I sprain my foot or I have some sort of back
Do you want to risk spraining your
or
ankle?
do I want to risk having a wart? Either one.
No.
So the answer was the wart, because at least the wart you can reverse it, Like once you
Yes.
sprain your ankle, it's like some part of it I've never really
And you already have
100% anymore.
You already have the resources to treat it at your
Yeah.
clinic, so it's like I'll
You just
take
need
the
to go
wart.
through the pain.
I might take the wart too. Now that I know you can fix it, because I think that is much easier to fix than a broken or a sprained ankle.
Correct, yes.
Yeah.
remove it yourself if you let's say touch
I don't know, man. I've never had it, so thank goodness. I'm tofu again. I've never had it.
Save us all.
So the other day, I knocked on the edge of the sofa, and then my nail came off.
Ouch.
But I didn't know until like a few days later. I noticed, hey, wait, my nail was like dangling. But so when you see a nail dangling, if it's like still adhering to it, then you can't really pull it out. It's quite painful.
What did you
But
do?
so I went to my clinic and I told my staff to like get rid of anesthetic for me. So I tried to inject it myself. But I tried to inject and numb myself. And then both my receptionists were like, I need to watch this. But end up I couldn't do it. So I don't know about wart, but then I couldn't inject myself. So what I did, I just got the what do we call it? The hem clipper. Clip. I just did it on my own. I just pulled it out.
I was just gonna ask, because it's pulling more painful or injecting yourself?
Because
It's more painful.
there was only a little bit dangling left, so that's why it's easier to just
Did you
pull it out.
evaluate
That's
like
why.
I've been through labor? This is like okay.
Because I can tell you sometimes when the patient comes with injection and all those things, for inguinal, right? They will say, oh, why don't you give me anesthetic? But if I feel that the patient only need to tahan a little bit, like a 10-20 seconds of pain, I'll say just try without it. Because if you really need it, we can stop and just give it to you.
Like man up, you can
But
do it.
yeah, otherwise the injection itself
with
is painful. I just be frank here, the injection itself is painful, so we try to avoid it if you can, because trust me.
Exactly.
We when we learn it as a student, we jab each other. So yes, so I can tell you it's painful because we've been through it. Like we jab each other like at least 2 to 3 rounds because you really want to practice, right? Like, and there's not that many patients who is willing to sit down and let you simply poke like that. So that's why we actually injected ourselves during uni before I reached this point. So it's painful for the injection.
Does your uni know about this? That you are injecting each other like
No.
that?
We are expected to do it. Like the teachers were guiding us.
But don't you go numb after you get injected?
it's only on the toe.
So the toe gets
for the
numb.
inguinal usually.
So every other day your toes numb.
No, not every other day. I think we did it like 3 times in total.
Okay.
Yeah. So in my final year,
it sounded
we did
like it was like a Monday, Wednesday, Friday.
No, my goodness. One of our
It's time.
one of my friend, like my classmate, like the first day already was a guy. He just went bang sun straight because he couldn't take it.
Okay, so if you're someone listening right now and you're wondering, I have some pain here or there, I'm a little bit confused, where do I go? Do I go to the hospital? Do I see Shuang? Do I see Kay? Anything under the knee that hurts, she's here for you. Anything above the knee, or specifically in your spine, neck, shoulder, wrist, any joint above, come and see me. That should be a simple way to settle most things. And
most straightforward way.
that's the first stop. And if we find that, oh wait a second, it's actually not, it's actually somewhere else, then we usually refer
so
to each
cross
other.
refer to each other quite a bit. Yeah.
And if you're listening down thinking, my feet hurt and my back hurts, but I've just been living with it, stop living with it. Let's do something about it.
Yes.
Okay? And lastly, before we wrap this up, one very last question, one final takeaway. What are some warning signs people shouldn't ignore when it comes to their feet?
Pain is definitely something. Okay, so if you have pain, the first thing you should do is, of course, if it's not like splinter or like a corn or what, and you have pain, general foot pain, then you should at least wear like a good sport shoes to try and see if it goes away. If it doesn't, then you should see someone. Or otherwise, any wounds in your foot that is not healing, or anything in your foot that looks like it's growing bigger and bigger, then you should see a podiatrist as soon as possible.
Exactly.
Yeah.
You don't have to go to the hospital for everything. FootDoctor Podiatrist could be a good first stop before you decide what next treatment you need.
Yes, anything related to the foot, except bone, like orthopedic bone surgeries.
But if needed, we can always refer you afterwards.
Yes.
Okay? Thank you so much for joining us today.
Thanks for inviting.
Thank you. And thank you all for listening.
Thank you.